Today we are covering chemotherapy administration and safety, a topic the NCLEX loves to test through priority and delegation questions. When handling cytotoxic drugs, your safety and the patient's safety are paramount. The exam will expect you to know that personal protective equipment is non-negotiable. This includes wearing a disposable, non-permeable gown, 2 pairs of chemotherapy-specific gloves, and a face shield for protection from splashes. A common exam question might present a scenario where a nurse is preparing to administer an IV chemotherapy agent and ask you to select all the necessary equipment. Ensure you choose all PPE items. Forgetting even one could mark the answer as incorrect. Another critical area is managing complications during infusion, specifically extravasation. This is not the same as simple infiltration. Extravasation is the leakage of a vesicant drug that can cause severe tissue necrosis. The NCLEX will test your ability to act quickly. If a patient receiving doxorubicin reports pain and you see swelling at the IV site, what is your first action? The absolute priority is to immediately stop the infusion. Do not pull the IV catheter right away. Some protocols require leaving it in place to aspirate any remaining drug and administer an antidote. This is a classic exam trap, testing if you know the specific steps beyond just discontinuing the medication. Myelosuppression or bone marrow suppression is a guaranteed topic. It leads to 3 major problems you must monitor. A great way to remember this is the mnemonic NAB, which stands for neutropenia, anemia, and bleeding risk from thrombocytopenia. For the exam, focus on neutropenia. A patient with a low absolute neutrophil count is severely immunocompromised. The NCLEX will give you a patient scenario with a low-grade fever, perhaps 100.4 degrees Fahrenheit or 38 degrees Celsius. For a neutropenic patient, this is a medical emergency, signaling a potential infection that could lead to sepsis and death. Your priority action is to initiate neutropenic precautions, obtain blood cultures, and prepare to administer antibiotics. Don't fall for the trap of simply choosing to administer an antipyretic. The underlying cause is the priority. Patient education is also heavily tested. You must teach patients on bleeding precautions, such as using a soft bristle toothbrush and an electric razor. For mucositis or painful inflammation of the mouth, advise patients to use a soft toothbrush, avoid alcohol-based mouthwashes, and eat soft, bland foods. For nausea, a common side effect, administering antiemetics 30 to 60 minutes before chemotherapy is a key preventative measure the exam will expect you to know. The NCLEX wants to see that you can anticipate these complications and intervene proactively, not just reactively. Master these specific priorities, and you'll be prepared for any chemotherapy question thrown your way.